Are you struggling with an L4-5, L5-S1 disc bulge and not sure which exercises are safe and effective for your condition? In this video, I'm going to show you 5 simple, safe exercises that can help relieve leg pain, reduce nerve irritation, and improve mobility, all from the comfort of your own home. If you're tired of constant pain traveling into your rear end, thigh, calf, or foot, this is an important video for you to watch. It's time to stop guessing and start using exercises designed specifically for disc-related leg pain. This video is important for people with an L4, L5, S1 disc bulge because doing the wrong exercise can aggravate nerve irritation and make your leg pain much worse. In this video, you'll learn how to perform these exercises correctly to help reduce pain and support your recovery. For more than 25 years, I've used these exercises with my patients who have experienced sciatica, disc bulges, disc herniations, and lower back pain to get better. Combined with the right treatment approach, they can be an effective part of a comprehensive recovery plan. Watch until the very end because I'll show you how to perform these exercises correctly and avoid common mistakes that can slow down your progress. In addition to that, I'll share simple decompression technique that may help provide additional relief for lower back pain, nerve pain, and disc-related leg pain. Let's get started. Hi, I'm Dr. Chris Cameron, a chiropractor here in Lucan, Ontario. I've helped more than 11,000 people overcome pain, improve their health, and get back to the activities they love doing using non-surgical corrective methods. This channel is for providing practical tips for managing neck pain, back pain, disc bulges, and other spinal degenerative conditions. Before I dive in, be sure to subscribe if you want to discover more tips on how to enhance your well-being and live a more fulfilling life. Before we get into the exercises, it's important to understand what we're trying to accomplish. When an L4, L5, L5-S1 disc bulge irritates a nearby nerve, it can cause pain, tingling, numbness, or symptoms that travel down into the leg. The exercises I'm about to show you are designed to address 3 important areas that often contribute to these symptoms. First, they may help improve mobility in the lower back and pelvis. Second, they help restore normal movement on irritated nerves. Third, they help reduce pressure on the affected disc and surrounding nerve structures. When you combine these 3 goals together, many people notice less leg pain, better movement, and improved function throughout the entire day. The first exercise is called the standing lateral shift decompression. This exercise is designed to improve mobility and help reduce pressure around the irritated nerve. It can be helpful in an L4-5 or L5-1 disc bulge if the bulge is causing pain that travels into your rear end, thigh, calf, or foot. To perform this exercise, stand sideways next to a wall with your non-painful shoulder closest to the wall. Position your feet about 2 feet away from the wall. Place your elbow against the wall for support. From here, slowly push your hips sideways towards the wall while keeping your shoulders relatively still. Move only as far as you can comfortably tolerate, then return to the starting position and repeat. As you perform this exercise, you may feel a gentle stretch or opening sensation in your lower back. Some people also notice that their leg pain begins to ease or move closer up into the lower back. This is often a positive sign because it may indicate reduced irritation on the affected nerve. A common mistake is forcing the moment too aggressively. Remember, you should not exercise into significant pain. The goal is to encourage movement and reduce pressure, not aggravate your symptoms. Start with 10 repetitions and perform 2 to 3 sets. You can do this exercise up to 3 times a day, depending on how your symptoms are responding. As your mobility improves and the movement becomes easier, you can gradually increase the range of motion. Many people find that these exercises are an important part of managing flare-ups and reducing disc-related leg pain throughout the entire day. Now that we've started improving mobility and reducing pressure around the affected nerves, let's move into an exercise that focuses more directly on restoring normal nerve movement. The second exercise is called the seated sciatic nerve glide. While the first exercise focused on improving mobility and reducing pressure around the affected area, this exercise is designed to improve the movement of the irritated nerve itself. When an L4-5, L5-S1 disc bulge causes leg pain, the sciatic nerve can become sensitive as it travels from the lower back down into the leg. This exercise helps to restore normal nerve movement without aggressively stretching the nerve, which is important because excessive stretching can often irritate or aggravate symptoms. To perform this exercise, sit tall on the edge of a chair, slowly straighten your painful leg while lifting your head and looking forward to the ceiling. Then slowly return to the starting position by bending your knee and bringing your chin down towards your chest. The movement should be smooth and controlled. Think of it as an exercise as gently gliding the nerve rather than stretching it. If you feel mild tension along the back of the leg, that is often quite normal. However, you should avoid pushing into significant pain, numbness, or worsening of the symptoms. Many patients report feeling less tension through the leg and improved mobility after performing this exercise consistently. Some people also notice that symptoms become less intense as the nerve becomes less irritated. Perform 10 to 15 repetitions on the affected side and complete 2 to 3 sets. This exercise can typically be performed 1 to 3 times per day, depending on the tolerance and the symptom response. As your symptoms improve, focus on making the movement smoother and more comfortable, rather than trying to force a larger range of motion. The goal here is to restore nerve mobility gradually over time. Now that we've addressed both the mobility and the nerve movement, let's move to an exercise that helps improve spinal positioning and can be especially helpful for people whose leg pain increases while sitting down. The third exercise is called the seated pelvic tilt. This exercise targets mobility in the lower back and pelvis while also helping you to maintain healthier sitting postures. This can be especially beneficial if your L4, L5 disc bulge causes increased leg pain when you're sitting for long periods. Many people with a bulging disc unknowingly sit in a position that places additional stress onto the lower back. Over time, this can increase pressure on the disc and contribute to ongoing nerve irritation. The seated pelvic tilt. This will help to become more aware of your spinal position and teaches you and the muscles that support your lower back to work more effectively. To perform this exercise, sit all the way back in a chair with your feet flat on the floor. Begin by gently tightening your lower abdominal muscles. From there, flatten your lower back into the backrest by rotating your pelvis backwards. Hold this position for about 5 seconds, then slowly relax and return to a neutral posture. As you perform this movement, you may feel the muscles in your lower abdomen start working harder. Some people will also notice a reduced tension in their lower back because they are moving out of a slouched posture. Removing from the slouched posture will remove tension. This movement should remain gentle and controlled. Avoid forcing the lower back hard into the chair. The goal is to improve awareness, mobility, and positioning rather than creating strain. Perform 10 repetitions, holding each repetition for about 5 seconds. Complete 2 to 3 sets per day. If sitting tends to increase your symptoms, you may find it helpful to repeat this exercise periodically throughout the day. As you progress, focus on maintaining better posture during everyday activities, not just while performing this exercise. Small improvements in sitting position can make a meaningful difference when managing disc-related leg pain. We've now worked on mobility, nerve movement, spinal positioning. The next exercise shifts your attention towards reducing pressure on the disc itself, which is often an important step in calming leg pain caused by an L4-5, L5-S1 disc bulge. The fourth exercise is the prone lumbar extension. This exercise is designed to help reduce pressure on the affected disc and encourage symptoms to move out of the leg and closer to the lower back. A response often referred to as centralization. When an L4, L5, or L5-S1 disc bulge irritates a nerve, pain can travel down into the buttocks, thigh, calf, and foot. For many people, extension-based movements can help reduce disc pressure and create a better environment for that irritated nerve to settle down. To perform this exercise, lie face down on a firm surface with your hands positioned underneath your shoulders. Keep your hips, pelvis, and legs relaxed and against the floor. Slowly press up through your hands and raise your upper body off the ground while allowing your lower back to arch comfortably. Hold this position for 1 to 2 seconds, then slowly return to the starting position. Move only as far as you can comfortably tolerate. You should not force the movement or push into significant pain. Throughout this entire exercise, keep your hips in contact with the floor and allow your lower back to do the work. As you perform this movement, you may feel a gentle stretch across the lower back. Some people notice that their leg pain becomes less intense or begins moving closer up towards the rear end and lower back. This can be a positive sign or response and may indicate that the irritated nerve is becoming less sensitive. Start with 10 repetitions and perform it 2 to 3 sets. This exercise can often be performed several times throughout the day, particularly if sitting, bending, or prolonged standing tends to increase your symptoms. As your mobility improves, you may gradually increase the amount of extension you achieve during each repetition. Focus on smooth, controlled movement rather than forcing a larger range of motion. While this exercise helps address disc pressure through a traditional extension movement, the final exercise adds a slight modification that may be especially useful for people who have symptoms that are more pronounced on one side. The fifth exercise is the prone lumbar extension with lateral hip shift. This exercise builds on the prone lumbar extension we just did, but adds a slight hip shift that may be helpful for people whose leg pain is primarily affecting only one side. In some cases of an L4-5, L5-S1 disc bulge, the bulge may create symptoms that are more noticeable on the right or the left side. This modified extension exercise combines decompression with a gentle positional correction that may help reduce irritation around the affected nerve. To perform this exercise, lie face down on the floor. If your leg pain is on the right side, slide your hips several inches to the left. If your leg pain is on the left side, slide your hips several inches to the right. This creates a slight banana-shaped curve throughout the body. Once you're in this position, place your hands underneath your shoulders and slowly press your upper body upward while keeping your pelvis and hips relaxed and against the floor. Move slowly and stay within a comfortable range. Hold the top position for 1 to 2 seconds before returning to the starting position. As you perform this exercise, you may feel a stretch across the lower back. Some people notice the tension in the leg or a gradual movement of symptoms away from the calf or the foot and closer up towards the lower back. This can be an encouraging response because it may indicate reduced nerve irritation. Start with 10 repetitions and perform 2 to 3 sets. Depending on your symptoms, this exercise can often be performed several times throughout the day. Pay close attention to how your leg symptoms are responding. If you notice improvement in your leg pain or symptoms moving closer to your lower back, that is generally a more favorable response than symptoms traveling down the leg. As your mobility improves, focus on performing the movement more comfortably rather than forcing additional extension. Consistency is usually more important than intensity when working with a disc-related leg pain. These 5 exercises target 3 key areas we discussed: mobility, nerve release, disc decompression. When combined with the right treatment and a healthy daily habit regime, they can become a valuable part of managing leg pain associated with an L4-5 or L5-S1 disc bulge. Now, let's move on to the bonus decompression exercise I talked about. As promised, here is the bonus exercise that many people find helpful when their lower back feels compressed or their leg pain is flaring up. This exercise is called the 90-90 decompression relief position, and its primary goal is to reduce pressure on the lower back, allow the surrounding muscles to relax, and provide gentle decompression for the discs. To perform this exercise, lie flat on your back on the floor and place your lower legs on a chair, on a couch, or an ottoman. Your hips should be approximately 90 degrees and your knees should also be about 90 degrees. Your thighs should be pointing straight up towards the ceiling while your lower legs rest comfortably on the ottoman or the chair. Once you're in this position, allow your arms to rest comfortably by your side and focus on slow, relaxed breathing. Try to let the muscles in your lower back, hips, and legs completely relax. Many patients report feeling a reduction in pressure through their lower back within a few minutes. Some people also notice their leg symptoms begin to calm down as the irritated nerve becomes less compressed. This position is often especially helpful after a long day of sitting. Start by holding the position for about 5 to 10 minutes. As it becomes more comfortable, you can gradually increase the duration to 15 minutes if needed. Many people perform this exercise once or twice per day, particularly during periods when their symptoms are more noticeable. This is not a stretching exercise, it's a recovery position designed to help your lower back settle down and unload the discs. For many people with an L4, L5, or L5-S1 disc bulge, it can be an excellent addition to the exercises we covered earlier because it reinforces the goal of reducing disc pressure and calming irritated nerves. You now have 5 of the best exercises for relieving leg pain caused by an L4-5, L5-S1 disc bulge, along with a bonus decompression position that can help reduce pressure on the lower back and irritated nerves. If you followed along with the exercises, I'd love to hear from you which exercises gave you the most relief. Was it the standing lateral shift decompression or the seated sciatic nerve glide? Drop a comment down below and let me know. If you found value in this video, please give it a like and share it with someone dealing with sciatica, leg pain, or a bulge disc. Doing that will help more people find practical, non-surgical solutions that may help them to move better and feel better. If you want more videos that help you to better understand what is actually going on and what's causing your pain and what to do about it, make it sure to subscribe to this channel. If you'd like to learn more about our 8-step multimodal treatment protocol to help patients recover from sciatica, leg pain, disc bulges, and disc herniations, click the next video up top here. I'll walk you through the exact approach we use to help reduce pain, improve function, and get people back to doing the activities they enjoy.